All right. Welcome back to the podcast. Thank you for all the listeners out there checking us out. My name's Ben Imes, checking in with a very special guest today, Dr. Zafirides. Wanted to get his input on multiple different things. Dr. Zafirides, why don't you introduce yourself and tell us a little bit about yourself?
Yeah, my name's Peter Zafirides. First off, thank you, Ben, for having me on the program. I appreciate it. I am a psychiatrist here in Columbus, Ohio. We're a private practice group of three psychiatrists. We've been in practice together. Gosh, we founded it in 1997, and we've still continued to go at it. So, see a lot of typical psychiatric patients in pathology, depression, anxiety, bipolar, ADD, and fair amount of ADD, given that we've got Ohio State right down the road here. So we get a pretty good student population that sees us as well. But really, just your bread and butter psychiatry. My particular area of interest in psychiatry has been in where the emotions kind of play in on physical symptoms, that mind body connection, particularly as it relates to chronic pain. But yeah, that's kind of the blush of the type of patients that I see.
And tell us a little bit more about your passion in that area, the mind body connection. Can you go a little bit deeper about what that means and how you're treating it?
Yeah, in that there's a personal story behind it too, that I had struggled with some pretty bad back pain back in the early thousands, and had gone through a bunch of different types of tests and imaging, and nothing could be found. And while I continued to struggle, traditional medicine was not solving it for me. And I happened to come across some books by an individual known as John Sarno, who was out of New York. And Dr. Sarno had come up with this idea that chronic pain, particularly when we can't find an origin for it, may have to do with the emotions, particularly anger, and
Mm,
that the emotions themselves are purposeful, and the pain itself acts as a protective distraction away from these emotions bubbling to the surface. So it is a survival based reaction. It's not necessarily hypochondriacal or neurotic or
okay.
anything like that. There's a protective function. And I was just very, very frustrated with trying to get help. And I didn't even realize his book was in my library. And I picked it up. And for the first time in like a year, I started feeling better. And while I always had that kind of idea of the mind body as it relates to psychiatry, that kind of solidified it not only for me, personally, which helped me come out
Hmm.
of back pain without having to do any type of procedures, but then kind of showed me a path professionally where maybe I could help people based on what I had learned.
Yeah,
So
absolutely.
I typically will see people who come in when their scans are completely clean, yet they're in a lot of pain, or they've been through everything and yet they still can't get relief.
Hmm.
And we go through the process of trying to find that relationship.
Yeah. Yeah. So they're basically these people that you're seeing in this specific category are at the end of their rope in a sense.
If you will, yeah, and,
Yeah.
it's really rewarding when we can kind of tap into that and actually see people feel better.
Yeah. And then talking them through about how to get them to that point. Yeah, that's really special. I feel like what I say in emergency medicine, sometimes, people, and you can speak to this as well, but I'll rule out all the emergent pathology that can be ongoing after somebody comes in with belly pain, right? And their belly pain's been chronic, it's been going on for forever, it's debilitating, they can't figure it out. CT's negative, labs look fine, urine's fine. And I say, well, from my perspective, I have nothing else to treat, you know? And that's when they come see you. And a lot of these people I feel like are carrying a lot of their anxiety and stress in their stomach. And I've heard about have you heard about the gut brain?
Yeah, I
Yeah.
have, and I think, we look, and fortunately, I think the tide is turning at least a little bit more acceptance of kind of this mind-body connection. Maybe not necessarily purely as it relates to chronic pain, but as you had just said, with regards to the, mind-gut connection. And really, I think the microbiome and the future
Mhm.
of that really going in and personalizing microbiome treatment, not only for emotions, but particularly for all illness. It's really, to me, a vast frontier that's just
Yeah.
starting to be tapped. So I wouldn't be surprised at all if we in the future start to see treatments that approach the microbiome that have far reaching implications to even maybe emotions as well.
Yeah.
People are always surprised when I tell them about 80% of our serotonin receptors are located in the gut, more so than the brain. So the question is how, when we treat people with medications, where exactly is the change that they start feeling better? Is it really up in the mind, those receptors, or are we seeing downstream effects by what we've created in the gut as well? So it really is fascinating.
There's still a lot to come.
Oh my gosh, so much.
How do you see the future kind of panning out in this way? Like, what are some things that you're excited for in terms of breakthroughs kind of in your field that you see, but also in your treatments as well?
Yeah, as far as traditional treatments, to me, one of the most exciting avenues are the psychedelics, and so much work being done at this point,
Mhm,
particularly with psilocybin, where
mhm,
we're just starting to understand some of the biological pathways and how response occurs. I really do think it's the devil's going to be in the details, the fact that it is psilocybin and what that history is. But really, if you tear that apart, take away the politics of that time when they had been sequestered away, these meds were very, very safe overall. It didn't cause dependence or addiction or anything like that. And I think this is why we're seeing such robust improvements in mood because of the way that they work. The one thing that concerns me with the psychedelics isn't the psychedelic itself, but is the actual experience. And I think where you're seeing more robust improvement in these individuals is taking, of course, the psilocybin, but having trained guides who can move you through that experience. That's probably
mm,
going to be as important as the actual biological effect. So that's going to be like, it worries me that maybe we get some type of psychedelic med and then it's not, but it's administered at home, which I don't think would give the same type of yield. But
right.
that really excites me. Obviously, the microbiome, we're early in that, as a potential frontier. And then really, where does the interface of technology, particularly AI, fit into mental health in the future? And you're starting to see a few avenues flush out, but it'll be interesting to see what happens as more and more kind of technological generations move through this AI in ways that it can help.
This seems to be keep coming up with the different business owners that I'm connecting with. It's in every conversation. It's kind of on the forefront. I think we're at the crest of the wave. The wave is starting to build.
Yes.
And I think a lot of business owners are trying to implement AI responsibly into their practices, but also trying to see just what things can be done with AI because it's not a we don't see it it's not a replacement, for medical providers. And the people that I've talked with agree with that, but it's more seen as an additive. It learns from, repetitive tasks. So what can it learn from? What can we teach it to be able to assist us in our practice, right?
Yes.
Speaking about the increases in technology and AI, how do you see that affecting specifically your business and your practice? Have you seen it in any way yet, or do you dream about anything in the future to help your practice?
Yeah, I've started to see little inklings of it, both personally, but also in what my patients are bringing in, and just the beginnings of where individuals are utilizing some of the cognitive therapy or overall behavioral therapy (LLMs) to try and get some form of therapy through Chat GPT or an equivalent AI. Some people have done it as kind of a bridge until they could get therapy. So I've had a few patients and with surprisingly positive results, and there's some early data to show that comparing it to face, at least in these early phases, you're getting a comparable kind of relief.
Mm,
So, to me, I always try and remember, Ben, that the bulk of the people who need my help or a therapist's help are not going to get them, right? Whether it is affordability, whether it is stigma or
yep,
awareness.
yep,
And, I could see this as a bridge without being, so nihilistic that everything is going to be AGI and the robots are going to take
sure,
over, right? So if we could take a
sure.
step back from that breath and just say, where could we possibly use this? I think that, that in those individuals that might not ever be able to through access or finances, could that serve as a bit of a bridge? I think that's an exciting, possibility.
Sure.
I agree with you. I think that, we have to learn to use it, adapt or die, because there are going to be individuals in all professions that are going to utilize that. Personally, where I have found it really helpful is kind of training the model and just giving me summaries of studies that might come out. So, just training my particular AI so that I get a list of the most pertinent studies that have come out and maybe a point by point analysis so I could look at that much more quickly than I would if I had to grab one of our journals, go through everything to try, right? And if it's a good, if it's something that I'm very interested in, link is there, I go right to the article, I can read it fully.
Hmm.
But I've never had it served up like that before. And it
Right.
really has fundamentally, changed my ability to consume that information very related to my field.
Hmm.
So those are kind of the ways that we're seeing it. It'll be interesting to see where it helps on just kind of the day-to-day business end of it, whether it is billing or prior authorizations and the like.
Right.
We'll see where that pans out. I think that's still early, but that's where a lot of the churn of expenses comes on the business end of the practice. So,
Totally.
I could see that in time helping out and really tremendously saving us expenses.
Well, yeah, I mean, I think the margins are very healthy from an initial standpoint, but it all remains to be seen how to implement. Kind of shifting gears over to just speaking about being a business owner. You've been a business owner for the better part of 2 decades, if almost three. You're coming up on your third decade of
Coming up on
ownership.
third, yeah.
Tell us about the kind of the pros and cons of owning your own practice and what that looks like and just the stresses, but also the joys behind that and kind of everything in between.
Yeah, absolutely. We started the practice in 1997, and our model or our mission was, can we build a practice where we see no more than 2 patients an hour? Can it be profitable?
Right.
Right, and we weren't trying to churn as much out of it, but, based on our philosophies, we wanted to see no more than 2 people an hour and have some time during the week where we could do, therapy, at an hour,
Mhm.
therapy at a time. So this fortunately, I was with a group of individuals and my partners that shared that same mission, and we tried to build it in that way.
Mhm.
So fortunately, since '97, we're still in practice. So clearly, there's a model there that works. But it has had its challenges. The going through insurance panels and seeing over the years what reimbursements have been or have gone down has been a challenge. We were a
Mhm.
much bigger practice before, and we had therapists as well as NPs in our practice. And, a lot of that was probably me being more of a novice as a leader, if you will.
Mm.
And I think I really regret one of the regrets I have, not many, but I really regret that I didn't take on more of that communication role. So I was so focused on my practice and seeing patients clinically that I think I really didn't realize the importance of being able to take time with those who gave time to our practice and maybe
Mm.
thoughtfully hear them and keep a culture of openness and discussion.
Sure.
I think we all got stressed. In the end, it worked out because our practice compressed down just about a year before COVID. So we
Mhm.
were at about our smallest at that time, which was a huge advantage as we went telemedicine for the better part of a year where we didn't need as much space. So it was fortuitous in that regard. But, looking back, I think that I think I failed there as a leader in maintaining that part of it. So that was an important lesson for me for the future.
Mhm. Yeah. Well, it's great that you can have the insight at least to be able to learn from the past mistakes. Transitioning from, I mean, obviously COVID was a big shift for everybody in the medical world. Do you see the kind of the shift to telemedicine and telehealth? Obviously, it probably affects your practice a lot just because there's that availability.
Yes.
Do you see that as being a place in the future where you're utilizing that on more visits, more and more visits? And yeah, kind of what direction do you see?
Yeah, it's obviously we were full telehealth when everything happened back in March of what was that, 2000. It's maintained steady. I still consistently anywhere, during the week anywhere from 40 to 50% of my patients are telemed. So it's gone from the necessity and
Right.
the terror of COVID to just convenience at this point.
Mhm.
And the thing that it's done has been it's almost eliminated cancellations, right? Because people are able to get online and talk. So that's been really the benefit. Not that we've added so many more hours, but those hours are consistent and we're seeing patients throughout the day consistently. I
Right.
don't I don't see that slowing down. I think that maybe psychiatry is one of the few specialties where you can do this almost as well as face to face. I mean,
Mhm.
personally, I prefer the face to face. I found myself having longer sessions in general when I'm in the room with a person as opposed to telemedicine. So
Yeah.
there are some trade offs, but I think by and large, again, if it means that more people are going to step up and get their health care, mental health care, then to me, we'll maintain down this model.
Yeah, and, even just we could gently poke around in the new regime or the new things that are coming about with Medicare, Medicaid, and kind of canceling a lot of healthcare for some people who may not have access. And obviously, Columbus, in your sense, not as rural, but with these rural areas, I wonder if it will increase or will be a necessity. You know what I'm saying? Just because of access to healthcare, access to care. These rural places, like telehealth might be more leaned upon from what I've, at least from my thoughts. I didn't know if you
No,
had
no, no.
thoughts about that too.
I I 100% agree with you, Ben. I think when we looked at the evolution pre-COVID of telehealth, you had to have specific licenses to do that, and it was mostly exclusive to whether it was a prison or some type of jail, and then underserved areas that were being served by, say, a community mental health center. Once COVID came and those restrictions were opened up, of course, one of the benefits is those that might not be able to get it because of locality now have the ability to do so. So
Right.
there's an interesting thing that happened here, just to get an idea, but not exactly this example of what we're talking about, but still important. One of my friends that I went to medical school with is also a psychiatrist. And so we're in Columbus. I'm originally from Youngstown, which is in Northeast Ohio.
Hmm.
He was practicing up there and closed his practice, and it was a fairly large practice. So, being that I'm licensed in Ohio, not that all of his patients came, but it was a lot easier to be able to transition those patients who wanted and were okay with
Mm.
telehealth for me to see them 180 miles away,
Mm.
right? So and because that area is not as highly served with psychiatrists or as dense with
Mhm.
psychiatrists or NPs, it was just naturally a flow over that could never have been done, pre-COVID, and it allowed for continuity of care for patients uh,
Mm.
who might not have been able to get care or might have been transferred back to their primary care doctor for a period of time
Right.
until those decisions were made, or perhaps they would travel up to Cleveland or something like that.
Right. But it just puts that much more stress on their system. But if they're offered an avenue, to be able to have access, I mean, even like you said, maybe even it's Chat GPT in the meantime until they're able to get connected via telemedicine. You know what I mean?
Yes.
But I just think that there's I think this is going to open up a lot of different avenues just in the sense of access to care. And I'm excited for it, honestly. My practice, I can't not see a person.
Either right,
Um,
right, yes.
I need to see them. I need to see what's wrong. They can't just describe it to me and show me on their picture or on the screen. But I'm excited for your specific kind of field as well as primary care, I think, as well. And just to see how kind of the telemedicine model, can it be optimized? Can it be, can we influence AI to be able to, scribe directly or to be able to also assist with, I don't know quite much about reading the emotions, being able to interpret facial language, body language via a camera. I'm not I don't know about that. That feels I'm curious about your thoughts on that.
Yeah, yeah.
What do you
Yeah,
think?
it's there have been some interesting early models that have looked at certain physical characteristics that could be measured by an AI in terms of eye blink rate, perhaps the amount of breathing that is happening, the fluidity and speed of talking that could add to the whole picture. So I guess it could pick that up. What's interesting to me, and I saw it about a year ago, it was Lex Friedman was interviewing Mark Zuckerberg, and they had both gotten scanned through Meta, so their whole body was scanned. I don't know how many hundreds or thousands of shots they took.
Hmm.
They rendered a real-time photorealistic avatar
Hmm.
that the two, and you may have seen that program, but it was the two of
Heard
them.
of
So
it.
Lex Friedman did the interview with him in that way. They were both in the same room, so to speak. They were
Right.
looking at each other,
Right.
even though they were apart. So, some of that technology, if it could be kind of distilled down to an accessible way, right? Maybe, I don't know what that would be. Maybe it would be an Oculus or, an Apple kind of
Sure.
a goggle where you
VR kind of
render.
stuff. Yeah.
Yeah, you render the person in real time, especially for us, right? So we could literally sit in a room and it isn't just over this, but we might actually get a three-dimensional view that would really mimic our settings at least. So, it's really fascinating to see where technology may go here in the future.
Yeah. And no one teaches you this in medical school. I'm assuming. I haven't been to medical school, but I assume that when you become a physician, you're like, okay, I can't wait to practice. But they don't teach you anything about business ownership
No, no, they
specifically. And
don't.
obviously you notice the learning points of leadership overall, but from a business standpoint, what are some things that you've learned that you're good at, or that push your business forward, or things that you're still seeing as hangups, other than the insurance kind of stuff that you kind of touched on earlier?
Yeah, I mean, I think in a business, the key is the partners that you work with. Do
Yeah.
they, one, share the same mission as you, and can you trust them? Right.
Hmm.
And that's really important when we talk about delegation of work within the business.
Hmm.
So I've been very fortunate that my partner, who's still been with me the entire time, Julie, is really good at the back end of a lot of this work. So where the numbers are done, or the accounting, or the taxes,
Yeah.
and the insurance companies, where I tend to be a little bit more forward facing in being able to bring in perhaps providers either to our practice, or bring in providers that are aware of our practice that send us patients. So I
Sure.
think just as important as the skill set are the people that you surround yourself with. I have been absolutely incredibly blessed, and I think our personalities play off of each other in a very positive way, and we balance kind of our weaknesses and our strengths to really continue to do well as a practice, as a business.
Yeah. That's really, I mean, it's growth, right? I mean, if you've had lots and lots of practice, it's good to have that also journey done with your colleagues, people who are bought into the same system. I think that's underappreciated in the medical world. It's mostly about who you work with, that you find out if it's a good fit.
Very true. I mean, the other parts of it, the actual tactical or logistical parts of the business is just learning, right? Here's how you do it, right? And if you don't know how to do it, who's the right person to bring in to do it,
Yep.
right? So you
Yep.
don't have to do everything, but the core of the group has to be solid, has to be trustworthy, has to share the same values. And we've been through difficult times where we thought people were who they were, but they weren't, and then we had to make the very difficult decision to let them go. So it's amazing how often that happens in practices in general, and how some practices have really, really suffered at the hands of maybe people who claim they were more than they were, and you see problems where lots of money has been lost either due to incompetence
Yeah.
or else.
Yeah. Other bad things. Yeah. Yeah, man. That's tough. I mean, but that's business ownership in a nutshell.
That's it.
It's
That's it. It's the
you
ups and downs. That's it. Yeah, that's how it gets.
Yeah, I mean, and it sounds like it's a very healthy practice in that sense, and really excited to hear kind of what comes from it. Just for our listeners' sake, we've shared a lot of good information about your practice and your dreams and kind of your business ownership qualities. If any of my listeners wanted to reach out or to find out your practice, where would they find you?
Sure. There's a couple places. I mean, we have our website, our practice. It's a little bit of a chewy website, centralohiobehavioralmedicine.com. But you could find it, certainly just Googling, me, that'll take you right there. I like to post a lot on LinkedIn. So if people are on LinkedIn, they can certainly find me there. I try to do as many posts as I can on just general mental health awareness, reducing stigma, and just some introduction into topics that might be of interest to people. So those are some ways that they can reach out.
And I definitely will push people to reach out if they're interested in the mind body connection and
Absolutely.
kind of learning about that field.
Indeed.
Yeah. Well, thanks for your thoughts today. I really appreciate your time. I think it was very special, and I hope my listeners can grab a lot of goodness from this. And we hope to chat offline very soon.
All right. Well, wonderful. Thank you for having me. I look forward to talking again at some point in the future.
Absolutely.
All
Thanks.
righty. You bet.